Visiting Nurse and Health Services of Connecticut was formed 100 years ago, 1913, by a group of ladies that formed a organization called the Cornelia Circle in Rockville, Connecticut. That group of ladies had the foresight to understand that home health care was needed at that time. And so they formed Rockville Public Health Nursing, which now is Visiting Nurse and Health Services of Connecticut. It consisted of one nurse, her name was Jenny Smith, and that first year Jenny Smith traveled thousands of miles, walked mostly, and she visited young women with children, maternal child visits.
I grew up with them, really. They might have helped my mother, but I knew them very well. I saw them every day somewhere. My mother had to have her cataracts off, and we had to ask someone to come there, and I can see them right now when they came. Yeah. Everybody liked the visiting nurses. They would give her anything she needed to have as medicine, and they'd take care of her eyes, and she needed, because we had to go to work, and they'd have to take care of her in her cleaning and so forth. Now this girl is a wonderful girl that comes from me. Oh, I couldn't make it if she wasn't there. She's pleasant when she comes in, and I think she's efficient at what she does.
Home health care really grew in the early 1900s. And as we grew and Medicare evolved in 1965, we grew so much that we became visiting nurse and community care, still stationed in Rockville, Connecticut. And then in the late 90s, as home health care really took off, we became Visiting Nurse and Health Services of Connecticut when we merged with the VNA of Manchester. And so that's where we are today. And we're also an affiliate of a very healthy and large healthcare system, Eastern Connecticut Health Network. Home health care was actually here long before hospitals. Home health care began, I believe, in the 1880s. It wasn't until the 1930s until hospitals really came to being and became kind of the center of healthcare. Now we are shifting back to home and community-based services being the center of healthcare.
The VNHSC is an extremely important component of our system because it enables us to care for patients at home, both before they need to go to the hospital and once they are in the hospital, when they're able to go back home. It enables us to bring all kinds of sophisticated care out to the patients in their home.
We generally provide home care services to patients who are in an acute episode of their illness. So typically we'll send a nurse out to see a patient, and she'll determine if the patient needs a physical therapist, or occupational therapist, maybe a social worker, and then a home health aide to provide personal care.
I think all of us as patients would rather be at home if we can be, and by making all kinds of services available, from nursing to physical therapy to wound care, we're able to keep patients at home where they're most comfortable, where they can be with their family members. I think for a long time it was considered an alternative to hospitalization, and now as our health system is changing, it's actually taking its own place as a place for providing care to patients.
In home care, our nurses are seeing patients today who are really critically ill. Some of them are discharged from the intensive care unit to their home. So we're seeing some really high-tech patients, and that takes really skilled staff, and I think we pride ourselves in the fact that we do have that staff and they're able to provide really specialized care.
Working with the visiting nurses is a real privilege. It has its challenges, but the rewards are so great. I don't know of any other practice arena where you can become so intimately involved with your clients and their families and have such an immediate impact on their lives and their ability to perform self-care, to get up and about, and to become safer in their homes and be able to remain in their homes for longer and longer.
I had a broken leg, and I chose Visiting Nurse and Health Services of Connecticut to help me with my care. The nurses and physical therapy would come into my home to do my dressing changes, help me with my therapy, my ambulation, my safety. I benefited from the visiting nurses with the emotional and physical support of the nurses and physical therapy, helping me with my safety, my dressing changes, and to relieve some of that burden from my husband and my children.
My doctor wanted me to have visiting nurses from Vernon, and they were just absolutely recommended by him, and he said that I was definitely going to need them in the beginning so that I would know how to do my exercises and handle myself and become a better. Beth was wonderful. I looked forward to her visit. She taught me how to get into my shower. She also, on 2 occasions, found some problems. She had to call my doctor, and she thought I needed an ultrasound on my leg, and she also, my elbow had swollen, and so she was very, very helpful. She taught me how to do all of my exercises, and she was very vigilant, kept telling me to slow down, and she wanted to make sure that I was doing them properly. She was wonderful.
Good.
The home health care mission is very local, it's very personal. For me, to be involved in such a great mission, which is founded on the basic principle that quality home and community-based health care serve to keep people in their homes, as importantly, keeps families together. This industry is so needed, and what we do is so important. I'm just proud to be part of it.
In addition to our home care services, we also have a hospice and palliative program. We use an interdisciplinary approach, providing patients with social work, pastoral care, and volunteers. We have a very large and active volunteer group, and they provide music in the home, pet therapy, massage therapy, and really measures to try and make the patient's last days as comfortable as possible.
When we learned that my husband was ill with cancer, we had to obviously bring some people into our home to help take care of him. And there was just no question in my mind that Visiting Nurse and Health Services would be the agency that we would choose. They were very well known in the community, they had a good history, and we had a very good comfort level. They came into our home, and it's very interesting when you think of hospice and you've never had it, it's totally different when the team does come into your home. They come in very quietly, calmly. They don't take over your home. They don't tell you what to do, but they assess what your needs are. And my husband, I have to say, was without any pain. They assessed his pain, and he was comfortable. The interesting part was he became very close to his nurses, and I think it was a happy time for him, even though it was a difficult time.
The tradition of the first 100 years, which is compassionate, good care for patients at home, in the community, is the one thing that simply shouldn't and won't change. But VNHSC has also done some very forward-thinking programs and services. The VNHSC is a very large user of home telehealth, so they've been able to bring technology into the patients' homes to be able to do even more than they could have done.
I chose the Visiting Nurse Health Services of Connecticut because of their reputation for being very good, very thorough, and reliable. Once a week, the Visiting Nurse and Health Services of Connecticut contacts me via computer, and we go over my weekly results that I send daily, which includes my blood pressure, oxygen, weight, and then I have a stethoscope and a chart, and Morella in the office guides me through where to put the stethoscope and she listens to my heartbeat and my lungs.
An affiliate of Visiting Nurse and Health Services of Connecticut, a caring hand works closely with home care nurses, therapists, and other community-based providers.
The importance of a caring hand and its relationship with visiting nurses is to enhance the visiting nurses' services as well as meet the continuing needs of our patients in the community. It is those services that will continue to assist those patients in the community to live safely in their homes. Once visiting nurses are no longer visiting, we can then care for those clients to ensure they age in place.
When I started working here at A Caring Hand, I started as a homemaker companion. Then I went to school and got my CNA. I became a CNA and then moved up to a PCA, which is a personal care attendant. I went into clients' homes. I helped them, bathe them with their personal care, anything they needed. Just kind of being there for them, for support, just to talk, just companionship. I got an opportunity in the office as a scheduler now, and that is where I am at the moment. I try to match the clients as best as possible with the skills of the caregivers to meet their needs. We are kind of an extended family to them. Being able to provide services and make them happy in their last days, last years, is important. It's rewarding.
This agency really promotes the team approach. So we work closely with the nurses and with the other therapists. Our therapists are assigned to nursing teams. We get to know the nurses very closely, and we work together with them to provide care and for optimal outcomes.
We really care about our staff, and I think the fact that they're so dedicated to their patients and want to achieve the best for our patients and for themselves.
Our mission and our vision is really centered around our employees. Without quality employees and a quality workplace and a workplace that rewards people, and a workplace that people want to come to work, we would not have the quality services that we have without those employees. Today, 100 years after our formation, we achieved the 2013 Connecticut Top Workplace Award, and it's something we're very proud of.
I am currently the team assistant for the therapy department. I schedule for the physical therapist, the occupational therapist, and the speech. I really have a wonderful group I'm dealing with. The team is tremendous. They are very gifted, caring, and accommodating.
Home health care to acute hospital care, and now back to home health care. Our future is very bright. We are in a very, very good position as being a leader in the healthcare continuum. I'm very hopeful that Visiting Nurse and Health Services of Connecticut will be here for another 100 years.